Hey everybody, Dr. Amy here. Today we are going to demonstrate dry needling to the flexors of the elbow. So I have one of my master's athletes here, Anne Marie, and she is going to be my demo today. So quickly, what is dry needling and how is it compared to acupuncture? So dry needling is Western medicine, a Western medicine based approach, while acupuncture is traditional Chinese medicine. So the difference between the two, one is Eastern, one is Western. And the Western approach is, the dry needling approach is that we dry needle the structure or the area that is in question. So that can be a muscle, tendon, ligament, joint, even scar tissue, and even nerve pain. So I'm just going to show you a little setup that I do and a little bit of the concepts behind it as I set this up. So we do use acupuncture needles. Every needle is sterile and it has its own tubing. So based on the anatomy of the patient, might be a little nervy. As a clinician, we have to know how the patient is built, and that's one thing that we learn when we go through physical therapy school. So I'm attacking her muscle flexor forearm area because she actually does have a history of some elbow tendonitis. So the way that I have been trained in the past is I apply an electrical component to this. So meaning I literally set up, it kind of looks like jumper cables to the area in question directly onto the metal aspect of the needles. And we apply a little twitch to that area. So essentially, patients always ask me, you know, what is dry needling? Like, what's the concept behind it? So I like to think of it like this, where think of a light bulb flickering and it's either trying to decide if it's going to go on or off. We think and interpret that as pain into the human body. So let me know, I'm going to turn this up. Let me know when it's strong enough for you to get a little twitch. That's good. So going back to this light concept, the light has to decide, or i.e. the pain, is it going to continue or is it going to cease? So essentially, we insert the needle or needles into the area that's in question, whether it's the tendon, muscle, ligament, or the nerve pathway into that particular muscle. And by doing that, we insert the needle into the area that's in question, we turn it, and then we apply an electrical component to it to get this muscle twitch in order to help keep the lights on, essentially. So we are disrupting this pain signal in order to tell the body, hey, it's time to start making your natural pain medicine, and as well as telling that area to kind of calm down. So we're getting blood flow into that area by essentially seeing a muscle twitch. I know it's kind of hard to see from here, but the muscles are actively twitching where the needles are inserted. And as far as the patient comfort, it should be comfortable. It shouldn't be nagging pain where it's like, you know, the patient's coming up off the table. Clearly, Anne Marie is not coming up off the table. So it's something that's comfortable, low grade, nice twitch, which then essentially disrupts the pain signal, and it helps create this natural, what we call opioid release. So instead of popping a lot of pain medicine that may be required from a physician, her body essentially right now is making natural pain chemicals or pain mediation into that area that's in question. So this is usually a typical setup. Now, based on Anne-Marie's history, I would personally apply more needles to the area that's in question. And coming from a clinician standpoint, we have to know how the human body is made. So that's very important. And then we also base it off of the patient's symptom.